Hi, and welcome to this session. I'm Dr. Mary Binoy, and I'm one of the language trainers at Envertiz Academy. Well, today I will be speaking to you about speaking, the module speaking in OET, and we'll be doing a couple of sessions on this in the coming weeks. So before we start on speaking, let me just take you through what is OET and how many modules we have. Meanwhile, we'll just see how many of the students will be joining us. So, as you know, we have 4 modules in OET: listening, reading, writing, and speaking. So, all these 4 modules will be tested on the same day usually. So, the speaking module, as I just mentioned, will be the last one usually. So, we'll be doing about speaking. So, as I told you, speaking is something that's a little bit difficult. So before we start, let's just wait for those students to join us. Well, I think we can get started. So speaking is something that all of you like to do. However, you find it quite daunting when you have to speak to an interlocutor who is most of the time a natural speaker, and you find it very difficult. So let me just help you with it and what could be done, because many a times most of the medical professionals find it really difficult to speak. And when you go to an English speaking country, obviously you have to speak in English. So it becomes quite a task. Now, just let me give you a small example on how this is going to affect you when you go to a foreign country, especially an English speaking country. Say you are a doctor and you have done your post-graduation in psychiatry. So you would be going to a hospital, or you'll be working in a hospital scenario where you will have patients coming in with mental health disorders, and you'll be talking to them. So you would have chosen this profession because you feel that, well, you can talk to people, you can, have them open their minds out to you. So obviously you're a good communicator. So as you're working, you have a desire to go abroad, you want to go to an English speaking country, and obviously you have to use your communication skills. Now, when you have to use your communication skills, and that too in English, you'll have to practice for this. To hone your skills, I think OET is going to be quite helpful in 2 ways. You need OET to go abroad because that's a qualifying examination. Plus, when you practice for your speaking in OET, obviously you'll be getting better in English. So you see, you are actually getting better on the language by practicing on this. So when you have the OET exam, you have OET exams for 12 different professionals. Let me just take you through those. Well, you have the professions that are tested or which have OET exams are dentistry, dietetics, medicine, nursing, occupational therapy, optometry, pharmacy, physiotherapy, podiatry, radiography, speech therapy, and veterinary science. So all these medical professions do have their own OETs. The listening and reading module would be the same for all these professions. However, the speaking and writing will vary. So this is exactly where you need to concentrate. So your speaking has to be according to your profession, which means that you have to know a couple of pointers on this. So just let me take you through that and what is actually going to be done on that speaking day. Well, the time duration for the speaking would be roughly between 18 and 25 minutes. You would be asked around 5 to 6 questions, warm-up questions, followed by 2 role play cards. These warm-up questions are just introductory questions. They're not usually evaluated, and it just helps you to get familiar with the voice of the interlocutor, with your own voice, and just to get a flow of the language. Now, these warm-up questions sometimes can go up to, say, 17 to 18 questions, but the role play cards are just 2. So you will have 3 minutes each for preparing each of the role play cards, and then 5 minutes of speaking. Now, you will be doing this with an interlocutor. An interlocutor is a person who will be actually helping you to go forward with your role play cards. The interlocutor will be actually enacting the role of a patient or a bystander, as according to the case, and you will be speaking with the interlocutor for the role play cards. Similarly, the interlocutor will be asking the warm-up questions. Now, let's just get started on the warm-up questions. The warm-up questions are quite a list of them. We have questions on different sections. For example, we start with introductory. That means we start with the name. Then we go on to the more professional questions, like based on the profession. We could also, they could also ask you some questions related to your career and how do you deal with things matters. So I would like to give you a few points that would be helpful when you do your speaking. I would say always that speak with clarity. Also speak in an audible voice, because the entire time your speaking is being recorded. So if you want your voice to be heard on that cassette, you have to be audible, you have to be clear. Moreover, try maintaining eye contact with the interlocutor. Although it's not a must, I think it's better, because rather than every time looking into your card and maybe not sounding audible, it would be nice to maintain eye contact. Secondly, maintain your tone throughout the speaking. Keep it in a way that's understandable. Give it its intonations, and as you ask a question, maybe you have to decide what type of intonation you want. Practice sufficiently before the exam. That's a must, because I've heard of a lot of students who go for the first time, they might be attempting an exam. Well, that's not recommended. So what you can do is, practice a couple of cards before the exam. I would say it would be nice to practice at least 20 to 25 cards of different scenarios, try known cases, unknown cases, different settings. We'll be doing all that in the upcoming sessions. Then obviously there are a lot of don'ts as well. Do not pause unnecessarily. Of course, you can take meaningful pauses, but see that you don't just pause and just wait there, lost. Go on to the next question. If you're not happy with the question that you've asked, you're not got a good answer, just go on to the next question. Do not use fillers like a, and don't keep doing that. It's kind of not something that is good in a speak. Next, speak in your natural accent. But don't let your mother tongue influence the pronunciation, because when the mother tongue does influence the pronunciation, the words might sound quite different. So don't do that. Maintain your accent. It's not an issue. Whatever accent you have is not an issue, but see that you have the right pronunciation. Never mimic accents, because you might have a tendency, maybe I need to mimic a British accent or an American accent. Not necessary, actually. You can use your own accent. Most important of all, and a great tip that I would like to give you, is record your speaking. So as you practice with someone, please record it. Okay, so you have mobile phones available today. You can just record it and then listen to that recording. So when you listen to the recording, you could correct two important things. One is you could, identify mistakes in your clarity and your audibility. So you can, when you listen to your speaking, you can understand, okay, well, I wasn't audible at that particular portion, or I needed to, use more of empathy in that particular question. So you can correct it, okay, and redo it and listen to it again and see how you can correct it. But I'm sure maybe you won't be able to correct your grammar or your pronunciation because you have done what you knew or you thought was correct. So the other two, that is your clarity and audibility, definitely can be checked. Okay. So now that you've got a fair idea about the do's and don'ts of speaking, let's get started on those warm-up questions. These questions usually start with asking about you and your background. Then, as I said, then going on to your work experience, career, and finally the profession-oriented questions. Your first question would require you to tell your name, whereby you need to give your name as given in your identification document, which would probably be your passport, which you have used for booking your exam. So that's your identification document. So say the name as given in that, because it's also for a clarification on the part of the interlocutor. And when you say your name, say it in a complete sentence. Many times I've heard students, when asked the name, just saying the name. Don't say it that way. Say it like my name is or I am, but never say myself so and so. It's a wrong way of saying it. It's grammatically wrong. So do not say that. Either say my name is or I am. So if asked to tell, now maybe they tell you, could you just tell us a little about yourself? You could say this starting with your name, followed by your profession, the college you graduated from, your experience, and finally your aim. That is your professional aim. So your answer could be something like this. My name is Mary Binoy. I'm a dentist by profession. I graduated from MES Dental College, which is affiliated to Rajiv Gandhi University of Health Sciences, Bangalore. I have worked for the past 2 years and now I'm preparing to go abroad for further studies. I would like to later settle in a foreign country. See, there you have all the information, and that's a good enough introduction. So it's not required to tell about your family unless, of course, you're asked, you specifically asked about your family in later questions. You could also frame the sentence differently according to, your work pattern. So if you're still working, you could say, I have been working for the past 2 years. Now, if you're a nurse, then I'm sure you would be posted in a particular department. So, your answer could be, I've been working as a nurse in the general ward of St. James Hospital for the past 2 years. So you're told which department you're working in and which hospital. So it gives a lot more clarity on what you're doing. Okay, so we go on to the next set of questions. The probable questions could be like, where are you from? Can you describe your professional background? Next, why did you choose to become a nurse, or why did you choose to become a doctor? Why did you take up the profession of a physiotherapist? So there are, a couple of professions that is approved by OET. So whatever you do, whatever you are, they would ask you, why did you choose that particular profession? Now let's start with that first one. For the first question, you need to say your native place or place of origin. So you would probably say something like, I'm originally from Kerala. Presently, I residing at Bangalore, something like this. Or you could say, I hail from Kadavantara, which is a part of Ernakulam district in the state of Kerala. So here I've given specifically where I'm from and where it is. So it's quite a good answer, I could say. It gives a clarity to your question. Now, the next question is, can you describe your professional background? I've already told what I am. So if I've already told, as you know, that question won't be asked. Next is, why did you choose to become a nurse or maybe a doctor. So say this question is put to a physiotherapist. So they would be asking, why did you choose this particular profession? The answer could be, I've always been fascinated by how the human body works, especially the muscles and bones. Moreover, after an accident, I realized how much a physiotherapist could help in regaining strength, mobility, and thereby the confidence of a person. So that would be the answer of a physiotherapist. Okay, so that takes us to the next set of questions, which would be related to your profession. Okay, so there are a couple of questions on the screen, as you can see. The first one, why did you choose to work in healthcare? What next? What do you enjoy most about your profession? What challenges do you face in your daily work? And how do you communicate with patients who are anxious and distressed? Let me take you through a couple of answers that I have formulated for different professions. Now, according to your profession, as I hope you understood, this answer changes. For example, for the first question of why did you choose to work in the health sector? If you're a nurse, your answer would probably be, nursing is a profession which allows me to provide care and comfort to people when they most need it. I'm also good at communicating with people, especially at times when they're most vulnerable. So we've got an answer for that. How the answer would be different for a physiotherapist. So for a physiotherapist, he or she would probably say, I love helping patients regain their mobility after surgeries or injuries. And it is fulfilling to see someone progress from pain and limitation to movement. Okay, so that would be the answer for a physiotherapist. Now we go to the next question. What do you enjoy most about your profession? Well, for this, a dentist could answer this question with, I find great satisfaction in helping patients achieve good oral health and confidence in their smiles. It is quite rewarding to see positive results from my work by helping relieving pain, restoring function, or improving aesthetics. Well, a pharmacist, however, would say in a different manner. As you would understand, it's not what the dentist would say. So pharmacist would probably say, what I love most about being a pharmacist is the opportunity to educate patients about their medications and ensure they use them safely. I like being a bridge between patients and doctors, thereby helping to improve the outcomes of treatment. See, it's quite different. It's not the same as what a dentist would have said. So I hope you understand that different professions have different ways of answering questions. Now, you have these questions. You need to understand the question and answer accordingly. If you feel confused or stuck, just take 2 seconds. Or if you think you don't understand the question, you could ask the interlocutor to just repeat the question for you. Maybe you could ask, sorry, I did not understand. Or could you please repeat the question? So I'm sure by then you would understand what it is and be able to answer. At no point should you feel unsure or doubtful. All these questions, I hope you have understood, all these questions have no correct or wrong answers. Because, these questions are your personal experiences and your personal opinions. So there's nothing as wrong or right. It's just to get your flow of English language. So these questions are asked and it helps you to, go on with this language. Now, moving on to the next question, the challenges faced in your profession. A physiotherapist could talk about his greatest challenge, which is, of course, non-compliance of patients with the exercise programs. And how does a physiotherapist overcome this? By motivating them, probably by telling them inspiring stories, setting realistic goals which are based on individuals, and also explaining to the patients about the importance of consistent exercise schedules. Now, this is not going to be the same answer for a doctor. A doctor would say, by reply by saying that his or her greatest challenge is difficulty in balancing patient care with administrative tasks, especially when consulting. You must have seen several times when you go to the doctor, or when the doctor is sitting there consulting, he has to enter the information into the laptop or the computer. So, he might find it a little bit challenging. But with everyday practice, this is becoming easier, and it's far more helpful than anything else, especially in today's computerized era. The last of the set of questions could be on communication, especially with anxious or distressed patients. So the question was, how do you communicate with patients who are anxious or distressed? A nurse would probably say, I always ensure that I handle anxious patients empathetically and patiently. I do this by maintaining eye contact, speaking slowly, and offering reassurance. Now, a physiotherapist would reply saying, I help patients manage their recovery from injuries or after surgeries by providing encouragement, celebrating their progress, however small it may be, and reminding them that recovery takes time. I feel it would be the dentist who sees this anxiety the most. Yeah, and therefore he or she would answer this saying, dental anxiety is very common, so I always take a gentle and reassuring approach. I feel that if each and every procedure is explained before it is carried out, they become less apprehensive for the patient. Okay, so I guess you've got an idea about what all these questions are. So before I proceed on with more questions, let us go for a short break. See you after the break. Hi, welcome back. Well, now I would like to take you through some questions that are profession specific, which means these questions would be asked to those specific professions, meaning the answers have to be formulated in regard to your own profession. So let me start with the questions usually directed at nurses. So you can see a couple of questions on the screen. It starts with, how do you handle a patient who is in pain? Can you describe a situation where you had to reassure a nervous patient? What steps do you take to ensure patient safety? How do you explain a procedure to a patient? And last, how do you deal with a patient who refuses medication? Okay, so let's go one by one. So we shall start with the first question. The first question asks how a nurse would handle a patient who is in pain. Well, she should handle the patient with compassion, offer emotional support and reassurance to reduce anxiety, which can also worsen the pain. Okay, so that's the answer. Well, the next question is, can you describe a situation where you had to reassure a nervous patient? Well, in this, I have a lot of times heard students saying it on a general basis, that is on an everyday what happens, or this is usually how we do. No, you have to say a particular incident that took place during your posting or when you were working. For example, you can narrate an incident when the patient was nervous prior to a surgery. So, how you calm the patient down, kept talking to her in a calm voice and deviating her mind. And finally, when it was time for the anesthesia to be administered, she was actually laughing at a joke that you said. So, you see, you have just eased her tension, and that is the particular incident. Now, the very next question is regarding the safety measures taken by nurses. The most effective and easiest method to ensure safety is to follow the protocols mandated by the hospital or clinic. The rest of the methods include prevention of errors, infection control, effective communication, and of course, safe medication administration. Well, the next question is, how do you explain a procedure to a patient? Well, when you have to explain a procedure, see that you put it in common man terms. Don't use difficult terms, and please do not scare the patient. So how do you answer this question is, you would obviously explain the step-by-step procedure in layman terms and tell it in a very calming voice. Say, this will happen next and this is how we're going to do. I'm sure you'll feel all right after it. So you're giving a reassurance. Now, the last question is, how do you deal with a patient who refuses medication? Well, let me see how you answer this question. So I would want all of you to type your answers and send it to us. You can, type it in the box below, and we want to see your answers. So I just want to see that. Please type it. Okay. Now we go on to the next set of questions, which is for doctors. Well, you have a couple of questions here, starting with, how do you explain a diagnosis to a patient in simple terms? Then, can you describe how you handle an emergency situation? What strategies do you use to break bad news to a patient? How do you manage a patient who is non-compliant with treatment? And last, how do you build a rapport with new patients? Now, I would like to take the most important one in this, in the sense that something that we all find difficulty in doing. What strategies do you use to break bad news to a patient? Which is quite a difficult task. And many times doctors try to, entrust this task to colleagues who are strong mentally. This requires a doctor to have compassion, clarity, and sensitivity. It's not that doctors do not have it, but, there are doctors who are able to handle such situations much better. Well, there is a technique to follow, which is known as the spikes protocol. So this, all the doctors would be knowing. So this is what is expected in your answer. So what's a spikes protocol? You would have to explain it in brief. The spikes, that is SPIKES. So what does the S in spikes, the first S stand for? It stands for setting up the conversation. Next, the P stands for perception, which means assessing patient's understanding. I is imitation, referring to determining how much the patient wants to know. K is knowledge, that is delivering the bad news clearly and compassionately. E is for emotion, meaning to respond with empathy. And finally, the last S stands for strategy as well as summary. Well, the next one, how do you, is regarding managing a patient. Well, I'm going to talk about how do you manage a patient who is non-compliant with treatment. This is quite challenging as the doctor's queries may not always be answered by the patient in a truthful manner. So patient has to be dealt with tactically. Patient might say, well, I've been taking my medicines. Maybe I'm not taking it regularly, and that maybe not regularly must be, regularly regular with medicines. Okay, so we'll have to ask. So the doctor should be understanding, communicate with the patient, and use his or her problem solving skills. So firstly, understand the reason for non-compliance. Then educate as well as address concerns. Later, involve the patient in a decision making. Simplify the treatment plan. Provide ample emotional as well as social support. Finally, follow-up should be scheduled, and any small progress should be encouraged. Now we have how do you explain a diagnosis to a patient in simple terms? Well, as I had just earlier said in the questions directed at nurses, you have to have simple terms. For example, instead of saying he's had a myocardial infarction, you could just say he's had a heart attack. Don't use a lot of biological words or medical terms as such. Try not to use these medical jargons, as we say. Keep it in simple terms and use these words to explain it. Now, can you describe how you handle an emergency situation? Well, when it is an emergency situation, obviously you need to remain calm, composed, and not add to the already difficult situation, and do what is required of you according to the protocol. So you might be, each emergency situation requires a different set of actions to be taken. So do accordingly. So how do you handle it? You have been trained for that, and you do it accordingly. So I guess you might have understood how things can be very different for each of the professions. Now we have the last question. How do you build rapport with new patients? This is something for you to do. Please try it out, see how you can answer it, and send us those answers. We would love to hear from you. Well, I have touched on almost half the professions that I had just mentioned. I think you've got a fair idea about how these questions are. And as I just mentioned in the beginning, we would be having several episodes on speaking. So we have just started with warm-up questions. Obviously, we'll be doing the criteria of speaking and how to deal with it. And obviously, a couple of role plays as well, which will give you a fair idea about what speaking is. So students, what I need you to do is start practicing. Okay, so you've got a lot of questions now, and I have asked you for answers to 2 questions. It would be great if you could answer back. And as I always tell, if you have any doubts, anything to be clarified, any suggestions, remarks, please write. Please put it in the box below so that we know what you require. And please start practicing. So wishing you happy speaking and hope to hear great scores from all of you. This is Dr. Mary Binoy signing off for now.